Schizophrenia. Schizophrenia is a serious mental health disorder which distorts the way people think, and a person with schizophrenia might see and interpret reality differently from a normal person. The first sign of schizophrenia is sustained personality change, unusual thoughts, which is extremely easy to miss. Schizophrenia symptoms are divided into two categories: positive and negative symptoms. Positive symptoms is a symptom that will keep happening in a person with schizophrenia, which include delusion, hallucination, disorganized speech, and psychosis. Psychosis is a condition that affects where your brain processes information, which includes symptoms like hear and see things other people don't, lack of emotion, which if left untreated can develop into an actual psychotic episode. Which symptom includes hallucination, which is when you can hallucinate sensation which isn't real, such as hearing voices when no one is around, strange sensation or feeling you can't explain, or you see things other people don't. And delusion, which is when you delude yourself into believing something that isn't real, such as if you have special powers, you can fly, or if you are on a special mission. Yeah. And on the other hand, negative symptoms, which mean that these symptoms can be reduced or even go away with time. These symptoms include lack of pleasure, social withdrawal, or lack of speech.
Schizophrenia is discovered many years ago by Dr. Emil Kaplan in 1887. Kaplan named this disorder earlier dementia. But in 1911, Eugen Burler came to knock the word earlier dementia out to change it to schizophrenia. He said that the symptoms are obviously not dementia, and he was also the first one to describe the symptom as positive or negative. The word schizophrenia comes from the Greek root schizo, which means split, and phrenia is mean mind. Despite this, there have not been no direct linkage of schizophrenia to split personality disorder. The evidence that schizophrenia is a biologically based disease of the brain has accumulated rapidly during the past 2 decades. Recently, the evidence has also been supported with a dynamic brain imaging system that shows very precise the wave of the tissue destruction that takes place in the brain that suffering from schizophrenia. On average, the brain is different in terms of total tissue volume and activity. However, there is most often no obvious single point of structural damage, a lesion. But here are some of structural damage caused by schizophrenia. Example: first is a reprinted permission from the New England Journal of Medicine 1992 show model A MI demonstration patient with schizophrenia. A schizophrenia patient shows shrinkage in left temporal horn, as you can see pointed by the arrow here. Second, Archive of General Psychiatry, page 57, line 65 to 73, show a decrease in dendritic spine density in model A. And this is reprint by the permission from Nature Review Neuroscience 31 2005, show a decrease in level of power booming expressed in prefrontal cortex as observed in model A. Today, the leading theory of why people get schizophrenia is that the result from genetic predisposition combined with an environmental exposure or stress during pregnancy or childhood that contribute to the disorder. Already, researchers have identified several key genes that, when damaged, seem to create predisposition and or increase the risk of schizophrenia. The gene, in combination with suspect environmental factors, are believed to be the factor that result in schizophrenia. These genes that seem to cause increased risk of schizophrenia include DISC1, disbidine, neurogranin, and G72 genes. The pathology of schizophrenia states that brain with schizophrenia appear to be sensitive to neurotransmitter dopamine in different ways than the brain with other conditions. Support for this idea comes from the drug that block dopamine effect on the brain, which seem to be lower the intensity of hallucination. The stimulant drugs like cocaine and methamphetamine are known to cause dopamine to become more active in the brain. The dopamine hypothesis has been dominant for a long time. However, a lot of recent research is no longer so clear that dopamine alone is responsible for causing schizophrenia. It appears more likely that other chemical messengers also involved in creating conditions of schizophrenia and psychosis.
This may include serotonin, which involves depression and anxiety. It may also include glutamate, which is known to involve the hallucinatory effect in the drug phencyclidine.
Schizophrenia occurs throughout the world. The prevalence of schizophrenia approaches 1% internationally. Annually, about 1.5 per 10,000 people are diagnosed with schizophrenia. Slightly more men are diagnosed with schizophrenia than women, and women tend to be diagnosed later in life than men. Model age of onset is between 18 and 25 adolescent years for men, and between 25 and 35 for women, with a second peak occurring around menopause. Schizophrenia is not contactable by physical means. However, 20% of the children with parents that have schizophrenia are known to inherit schizophrenia as well. The chance rises up to 40% if both parents are known to have schizophrenia. The chance can rise up to more than 55% if one of the identical twins was diagnosed with schizophrenia. Although currently there is no cure for schizophrenia, you can treat and manage it with medication, self-help strategies, and supportive therapies. Medications are the cornerstone of schizophrenia, and antipsychotic medications are the most commonly prescribed drugs. They are thought to control symptoms by affecting the brain neurotransmitter dopamine, which is more effective when combined with behavioral therapy. Data from National Institute of Mental Health states that if medication for schizophrenia is discontinued, the relapse rate is about 80% within 2 years. With continued drug treatment, only about 40% of recovered patients will suffer relapse. These are the overall data after years of people with diagnosed schizophrenia. People with untreated schizophrenia may become embedded with their personality, and the schizophrenia may prevent people from seeking help from professions, which strongly link to why people with schizophrenia have a higher than normal chance to commit suicide. Schizophrenia is considered the most chronic, debilitating, and costly mental illness. The estimated economic cost of dealing with schizophrenia from a societal perspective in the United States totaled $155.7 billion in 2013, according to a new analysis group study led by Principal Eric Wu. This graph shows substantially greater caregiving costs to a family member as the indirect cost of unemployment, 38%, and caregiving, 34%. Contribute even more to the total societal cost of schizophrenia than the direct health care cost, 24%. Since most schizophrenia patients are never able to work, they must be supported for life by Medicaid and other forms of public assistance. So this is why education for the patient, their family, and the community surrounding them is important. So
We,
Together,
as
as
a
a
community,
community,
can help prevent the misunderstood or violence toward people with schizophrenia.
for the better life of people with schizophrenia.
and for the society
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 to be a better place for our generation to live in.